Prior to having a knee replacement, we need to talk about all the possible risks that could happen around the surgery. The first one is infection. Risk factors for infection include diabetes, smoking, obesity, history of infection, and poor nutrition. We try to optimize all of these to minimize your chance of having any infection. The next one is bleeding. Bleeding is relatively low risk with modern anesthetics, and transfusion is extremely rare. Third one is nerve damage. Having any major nerve damage after surgery is relatively rare. Most people do experience numbness on the outside of their incision afterwards, just the outside portion of the kneecap there. This can be permanent, however, it's not typically a major bother for patients afterwards. There's a risk of having the components loosen over time. There's a risk of having the bearing wear out over time. There's a risk of continued pain. There's a risk of stiffness, and that's why I emphasize and talk so much about early motion and being aggressive and active in your physical therapy. There's a risk of continued pain. There's a risk of being unsatisfied with your knee replacement. Studies have shown that with a hip replacement, the satisfaction rate hovers around 95%. It's very successful. However, with knee replacement, it's in the low to mid 80s. So there's a subset of patients who are just unhappy with their knee replacement afterwards. So we just don't have knee replacements figured out quite as well as we do hip replacements. And there's a higher rate there of people who are unhappy or unsatisfied after their joint replacement in the knee. I think a big part of those unsatisfied patients are setting the proper expectations. It's important to know that this knee will be a stable, relatively pain-free knee, but it won't be as good as your knee was when you were a teenager, for example. There's a risk of pulmonary embolism and blood clots. There's a risk of what's called chronic regional pain syndrome, or a reaction afterwards where the nerves react and become sensitized and traumatized, but this is extremely rare in my practice.